This conference will now be recorded.
I'd like to welcome everyone this evening to Tuesday, January 18th, 2022, Bladen County Commissioners meeting. Before we start tonight, I'd like to recognize that Dr. McGoins is not here, still under the weather, but she's Zooming with us tonight. And before we have Reverend Jonathan Hayes of Wesley Chapel to come up, when you come up, sir, we'd like to pause for a moment to recognize the late Jimmy Smith, who was a former commissioner for several years. Remember his family, and in honor of him, let's pause for a couple of moments of silence. And Mr. Hayes, come on up if you would. And then after that, Mr. Parker, if you'd lead us in pledge.
Lord, we come to you tonight. We thank you for this commissioners meeting. And Lord, as we come into your presence, Lord, your word says to enter your gates with thanksgiving and to enter your courts with praise. And Lord, we remind you of your word in Psalm 91. It says that we who dwell in the secret place of the Most High will abide under the shadow of the Almighty. And tonight, Lord, we say that you are our refuge and our fortress, our God, in you we will trust. Lord, in your word that you'll deliver us from the snare of the fowler and from the perilous pestilence. It says, Lord, that you'll under your wings will take refuge. Lord, it says that we're not to be afraid of the terror by night or the arrow that flies by day or the pestilence that walks in darkness or destruction that lays waste at noonday, Lord. We thank you, Lord. Your word says that no evil shall come near us, nor any plague come near our dwelling place. God, we pray that you would be with the meeting tonight. Lord, that your wisdom would flow in here. God, your word says that the fear of the Lord is the beginning of wisdom. So, Lord, let your holy, reverential fear return to every fabric of politics, to every fabric of government, to your church. God, I pray that your spirit would move in Bladen County unlike it's ever been felt before. God, we need you. We need your presence. We don't need religion. We need you. And so, God, I pray for these men and women in this room tonight. I pray, Lord, that they would work together. Your word says that it's a good thing for brothers to dwell together in unity, and I pray there be unity. I pray there be peace. I pray there be joy. I pray for the nurses and the doctors, Lord, that you would give them comfort and strength. I pray, Lord, that people would recover from the coronavirus. I pray, Lord, that the cases would go down. And I pray, Lord Jesus, that you would be glorified in everything that we do. We ask all of these things, Father, in Jesus' name. And everyone said,
Amen. Thank you, Mr. Hayes.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We get a motion on 10 items.
That's the brother.
Second by Mr. Peterson. Second, Mr. Cameron. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. McGowan?
Yes.
Yes.
Mr. Gillespie?
Yes.
Thank you for that. If I can get all the commissioners to go down front, will you please, to recognize the employees for years of service and recognize employees upon retirement. So we're gonna go by our list of the ones that are not here. On the first two, Crystal Rogers, I don't think she's here, but we'd like to recognize her for 5 years of service to the county. Jill Sampson, Jill is 15 years at DSS. We would really like to thank her as well. Next, Tanika Johnson, she didn't make it. Clerk, her name was on here, but she didn't make it. DSS, also 15 years of service. And make sure that you thank her as well. Timothy Brown, EMS. Come on up, please. Timothy's been with us 5 years. On behalf of the county, we appreciate your service, and we look forward to many more years. Thank you very much, sir. And have a little something here for you. And again, we thank you so much.
Can't say enough about this guy right here. He retired from the military and he decided to come play in the streets with us with EMS. Does an excellent job for our department. We're glad to have him. He's a true asset to us. Thank you, Tim, for everything. Thanks.
Thank you so much.
Thank you, buddy.
Thank you.
Andrea Singletary. Health Department, 15 years. I forgot to tell you, when you're married in the family, we expect 35 years for retirement. Is that okay? But Andrea, again, on behalf of the county, okay. I didn't think you have a little handout to give you. We want to thank you for your 15 years of service. Hear a lot about you and a lot of good things, and we really appreciate you very much.
Thank you. So Andrea served her first 8 years here with the home health program and her last 7 in the at-risk for children. She serves children 0 to 5 years old and has almost tripled the number of children that she has served in the last 2 years. In addition to that, she's the first certified case manager in the history of the health department. Congratulations for all you do.
Thank you.
Thank you. Thank you so much.
Becky Gilbert, Health Department, 25 years. Please make sure you see her and let her know how much we really do appreciate it. Dale Lewis, Information Technology, 20 years. It's always a pleasure with all these numbers of years people give us. Wendy Martin, Registered Deeds, 10 years. Daniel Miller, Sheriff's Office, 5 years. Gary Turlington, Sheriff's Office, 5 years. James Monroe, Sheriff's Office for 10 years. James. Penny Britt, Sheriff's Office Communications, 20 years. Again, thank each and every one of those. We all know how hard it is to get and maintain employees now, and to have people of this years of service. It's very appreciated, always, but especially at this time that we're going through. Thank you so much. On retirees, James Hilburn, Animal Control. He retired the 31st of December. Deborah Jones, DSS. In grateful appreciation to Deborah Jones for dedicated service to the people of Bladen County as Income Maintenance Fraud Investigator 2, presented by the Bladen County Board of Commissioners, given this 18th day of January 2022, 17 years of service. Again, on behalf of Bladen County, we thank you for your years of service, and we hope you enjoy your retirement.
Deborah came to DSS as a temporary worker. Who knew that she would stay? But we did when she came on board with us. She soon, after she served in a food stamp position, she transferred over to adult Medicaid, which made her a perfect candidate for our fraud investigator position. We credit Deborah for helping us to revamp our fraud investigative position and to create a better program for us. And with her guidance to us, she has helped us to start prosecuting. So Deborah has a lot of good years with us, and we certainly appreciate all that you've done for us, Deborah, and wish you well in your retirement.
Thank you, thank you. How you doing? Thank you so much.
Congratulations. Emily Bronson, DSS, also retired 12/31/2021. So again, when you see her, please let her know and her family know how much we appreciate her years of service. Linda Clark, Economic Development. A grateful appreciation to Linda Clark for dedicated service to the people of Bladen County as Administrative Secretary presented by the Bladen County Board of Commissioners. Given this 18th day of January 2022, 17 years of service, retired and still here, and that's a blessing. Thank you so much.
Talk about wearing a lot of different hats. I think when I was up here at my retirement about a month ago, I talked about that I was one of the most spoiled people in all of the county and economic development. Well, Linda's one of the big reasons that I was one of the most spoiled people. She's one that, that makes it easy on me. In economic development, we do a lot of things. She's our event planner. She puts together our PowerPoints. She's our technology person in this department. But I think one of the places she's had the biggest impact is on the grant writing and reporting. Y'all, grant writing, reporting, administration is one of the most miserable jobs you'll ever do. And we give Linda the worst part of it. Part of the reason I say I'm spoiled. I do the narrative fun parts, and Linda handles all the grunt work, and she's great at it. So in her time, we've created hundreds of jobs, but literally brought millions of dollars of grant money into the county, and she's been a huge part of that. We've had a great team to work with. So congratulate Linda on all the success and her retirement, and looking forward to continue to do big things. She's working with us still in Bladen Blooming right now, and we're working on some neat projects for the community. So
I'd like to say this too about Miss Linda. Normally when we meet Bladen Blooming, it's at lunchtime. And how many people go out to eat and your food's always got the order wrong and all? I don't know what kind of influence she has on the rest of the week, but she always gets everybody's food just like you ordered it. I don't know how you do it, but you do great.
there's not a pickle in Ray's plate.
Not a pickle near his plate. Thank you for doing it. Thank you, Linda.
Thank you, Ms. Linda.
Mr. Willie McLaughlin, and he's not with us tonight too, but he retired on 12/31/2021, and I had a good chance to spend some time with him the last day that he was here. We had some good time. Mr. Phil Corbett, Sheriff's Office. This right here. And grateful appreciation to Phil Corbett for dedicated service to the people of Bladen County as a chief jailer, presented by the Bladen County Board of Commissioners, given this 18th day of January 2022 for 30 years of service. We really appreciate that.
This guy right here, he really has served 2 years. But he didn't want anybody to know that. This guy, I didn't even talk about 8 months ago. I mean, don't say a whole lot, but when he talks, everybody listens. And I'll tell you this, and I'm very proud of this. We just had some promotions 3 weeks ago.
2 promotions that were made for this man right here. He came to my office and shut my doors, and I need to talk to you. He said, if you want that teaching center to keep running smooth, this is what you need to do. And it did fall on deaf ears. And he will be missed. He said he'll come back and work part-time. I pray to God he does that. This is a wealth of knowledge right here. He knows more about the teaching center than I'll ever know in my lifetime. And we'll never be able to repay Phil for what he's done. We've had a lot of bad situations that could have really went bad, and he calmed it down. And for that, I'm indebted to you. God bless you.
Sir, please.
Thank you, sir.
Mr. James Monroe.
He did check since it was late.
We want to thank Mr. Monroe for 10 years of service to the county. Appreciate it very much.
Thanks, sir.
I'll let the sheriff do all the honors here.
First Sergeant James Monroe, one thing he's very punctual at everything. I came there 10 years ago. He was a regular deputy. He had been promoted to rank of corporal, sergeant, and now he's first sergeant of uniform patrol. And I'll tell you, what is one of his strongest traits is loyalty. He's loyal to me. He's loyal to the sheriff's office. And he's loyal to the citizens of the county. He does a lot that people never see. He does all the brain work to make things happen. And for that, we should all be, and he cuts trees on the side in case you didn't treat.
Yeah, that's why I was late, but I had a flat tire.
But I wish him the very best. 25, 30 more years, all we need out of him, and he'll be done. But he does a great job for sheriff's office. Thank you. Thanks, sir.
Individual delegations wishing to address the Commissioner Matter. Matter of interest to commissioners. Take care of A first. Consider adopting a resolution on statewide workforce development board realignment. Pleasure of the board.
Motion to approve.
A motion by Mr. Peterson. Second by Mr. Hester. Any further discussion? Roll call.
Mr. Britt,
Yes.
Mr. Hester.
Yes.
Mr. Peterson,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Mongoen,
Yes.
Yes.
Mr. Gillespie.
Anyone have anything to say to you?
Mr. Chair, I received a email from Reverend Joyce Lawrence, and she wants to restart the community outreach at the courthouse. And she's looking at starting this April the 16th, around 12 o'clock. And she asked me to check in to see could that happen. Apparently she was the overseer of all this activity.
What is it about? I mean,
she said it was her desire to start the community outreach. I'll find out more about it and give you more information.
It was a prayer meeting, right?
I think that's what it was.
Joyce Lawrence?
Yes.
It was a prayer meeting, a gathering of some capacity.
Okay.
Mr. Martin, I already have a form you have to fill out.
Yeah, I'll be glad to, I mean, if you'll give me her number after the meeting.
I give you, let me see. I got her email address. Yeah, I think I got her phone number.
Okay, I'll be glad to.
Okay, I'll give it to you.
Martin, if you can do that and get back with us next meeting.
Thank you, sir.
Yes, sir. Anyone else?
I got one request. I would request again that the Bladen County Board of Education come and give us an update on the building. That's all you.
I talked to Mr. Atkins, right after their last meeting, and, he said they still had a couple things they had to resolve, but it might take 2 of their meetings to be able to, mention that to Mr. Martin today. They were working on some things.
How many,
And then they would,
how many meetings you say?
he said, it may take 2 meetings. They've had one, now they've got the second coming up. Then they should be prepared to do so.
I still request that they come and make a presentation to us where the status of the building of the school.
And that is what they're going to do. They would get it all done in one meeting, things that they're having to do and work out.
We talked about this last time, and I didn't want to get in an argument about this thing tonight, but I will if I have to. But Commissioner said we'd give them another meeting. If they didn't come, then we would request they give us a date. So what I understood at the last meeting. So,
Mr. Chair,
Yes, ma'am.
at this point, I think they're running out of time. Their timeline is getting short, so I did not want to push their issue or require them to come to the board, to the commissioners, but at this time, they need to give us a date for this month. Because if you're not, they will not be able to meet any requirements that they have presented to us in the past.
Specify your requirements. What are you talking about, Dr. Mongoan?
They
What
told us that
requirements?
the school, the septic at Tar Heel is an issue still. It's also an issue. They said the kids will be able to go into that school in August of 2023. If they have not gotten the contractor or have put a RFP out for them to bid on, and that's going to take some time. So they need to, they are running out of time.
And I'm assuming they're aware of all that, and they said they were working on that. I'm just trying to keep peaceful negotiations between them. And I think they're doing what they can do based on what he said, but they're having to work some issues out, and they said they would be coming. So I don't see the need for getting the county and the school board and the citizens of this county broken up between the commissioners and the school board members. They know their situation better than I do. I supported this system, supported them getting to school.
Yeah, and their two of their board members said they were about ready. They think they need to come anyway. So I did talk to them.
Mr. Chairman.
The only reason is I'm somewhat in agreement with what you're saying with having that communication relationship. But the thing that I'm looking at and trying to take in perspective is a timeline, because right now they say building material going up 2% every month. And you look at what it's going to look like in 2 months on $40 million.
Mr. Cogdale.
It's going to be up at the roof. So
And it's like I said, we're not wanting to do no arguing, but I would think that their mental capability, they understand exactly what you said. I think they're probably aware of it just as much or more so than we are. And I give them that credit for them knowing that. But there's some underlying circumstances that we don't know, and they're working them out. I can only share with you what the superintendent told me. But I'm just one person on this board. There's 9, so y'all do what you want, but you know what I'm saying.
Just maybe I'm sort of a happy medium here. Do we know when their second meeting would be?
They meet again on the 10th, and then what do you meet?
Normally,
Monday.
So if we requested for them to be at our meeting on February the 21st, then that would give them the time that they requested to have their second meeting, but it would draw a line in the sand to say, here's when we request that you be put on our agenda.
And go back to what I said initially. It'd probably take 2 meetings for them to get, so that would be on that time.
Right. That way we're doing what they asked, but it gives us a deadline that, hey, here's when we'd like.
Right.
And let me just say one more thing. We've got a $40 million building to build, but right now, we don't have any half the teachers. Right? My daughter has 2 teachers left.
Right.
And so we got, there's, people are calling me and saying, hey, what's going on? I'm not on the school board. I'm a commissioner. Yeah, but ultimately we answer the citizens of this county. They're sending their kids to school. And I'm all about building nicer, better schools, but my goodness, if there's nobody there to teach them, no matter what kind of hospital we build, and how many doctors, I mean, it's like, so I think we've just got some other questions we need to ask as well.
Mr. Speaker.
I'm a little confused. All we're asking them for is to come to this Board of Commissioners room, sit right there and give us an update on those schools. That's all we're asking. That's all I'm asking for. And if they can't give us an update, we better be worried.
And I think.
If I need to make a motion, I'll make a motion.
You can do what you like. I just said, they said give them 2 meetings and they would be here. I don't know how much clearer I can be than that.
I make a motion that we ask the school board to come in the month of February, the 21st.
On the 21st, that's the time frame.
And the motion would be, that's what they said anyway, so you can make the motion if you like.
Well, I mean, I'm not sitting there trying to defend them. All I want to do is an update because it's county tax dollars, and like I said last time, they don't have the authority to borrow their money. And I think it's time for the commissioners to be a little alarmed or a little worried about this project. 2% on $40 million is $800,000 a month.
Yeah. They're very.
And it's the biggest building project ever happened in Bladen County.
And they push for it. And I think some of us here supported it. Some of us didn't support it. But I stand here supporting it and giving them also the opportunity to do what they said. And I think they're going to do what they said, and that meeting would be in February.
I got a motion on the floor.
You got a motion? Second? Second. A second. So, Mr. Cameron, any further discussion?
Just one question.
Yes, sir.
In this proposal that you're asking for Mr. Peterson, make sure that we're clear on what you're asking them to do. What is it you want specifically to do?
For me?
In this motion, yeah, in this motion.
I want to come give an update of where the project is. I don't know what that is. I want to know where they are on the project, where they are on business, where they are on the project. That's what I want to know.
And that's what they're offering, Mr. Cogdell. When they have their second meeting.
Have they agreed to come on February 21st?
They just said after their second meeting. He said probably take 2 meetings, so I would assume that would be the case, sir.
Okay.
I guess we're asking them either way. Where there's a motion, we're asking them to come. Where there's not a motion, we're asking.
We're leaving out a motion, they said they were. That's why it gets me. Without a motion, they said give them 2 meetings. They would come. They've had one, they're gonna have the other one, and they, based on what they said, they've got it worked out.
I call for question.
Yes, sir, Mr.
Why did they come to this, us and make that request? They could have come before us and made that request that they would be bad too. Well, they asked for 2 weeks.
Whether we responded in the letter.
Yeah, well,
Mr. Martin.
it doesn't make any sense. It doesn't make any sense. They could have come here before us and gave us that little bit. At least they came before.
I agree with your transparency. I don't, it's such a big project. I don't understand I don't think it's, and I don't think it's stepping on boundaries. I don't see it.
All we're asking them to do is just put it on our agenda.
Yeah, Mr. Chairman, the reason I'm asking the questions, I remember we came in here and we went through a rush type situation.
Very fast.
Clear that $40 million. Yeah. And we put everything on hold. Normally, that's something we don't do is vote on money at the same meeting. But that night, we went ahead and voted on it. And we asked them just to come in.
We actually had a meeting prior to, and then we voted in our meeting.
Yeah, but
our meeting was after that.
Yeah, we asked them just to come in and just give us an update on this, and we thought things were gonna be happening, and nothing is happening.
Mr. Martin, have you heard anything back from Dr. Atkinson?
No, sir.
Other than that email
I shared with you 2 weeks ago. My thing is, the only thing that gives me that stands out the most of all is that they came in and we heard them discuss about the amount that contract that building's gonna cost. At 22 million. I remember we had that conversation.
Mr. Cogdell, I have no problem with the motion because we're just doing what they said they were gonna do anyway. But the motion's fine. Roll call.
Mr. Brett,
Yes.
Mr. Hudson.
Yes.
Mr. Peterson.
Yes.
Mr. Cogdell.
Yes.
Dr.
Yes.
Mr. McGill.
Yes.
Dr. Von Goen.
Yes.
Mr. Gillespie.
Yes.
Thank you. Anybody else got anything else to say about anything else? Finance Department, Ms. Lisa Copa.
I'd like to review the dashboard for the 6 months ending December 31st of 2021. The revenues for the general fund came in at 53.87%, and the expenditures were at 46.84%. On the solid waste fund, the revenues were 57.56%, and the expenditures were 35.89%. Emergency telephone was at 12.49% and spent 9.32%, and the water was at 52.37%, and the expenditures were 25.22% of budget. Any questions on the dashboard?
Wow.
I'll go ahead with the federal EMA program. At the end of December, we still have a positive time, and it looks like right now we're on track to break even again. So we're still keeping our fingers crossed. Any questions? Thank you.
Thank you, Ms. Coleman. Thank you. Mr. Kip McCleary, General Service Department.
Good evening.
Good evening, sir.
I was asked to bring an update to you on our most recent bids for our paving project for this year. In putting this together, we determined that hopefully the best method of obtaining bids was if we grouped all the individual projects into one bid, but keep it in such a way that each project could stand alone and be bid individually. There was a total of 9 projects, beginning with emergency services, potential new paving, Division of Aging, which would be resurfacing, Department of Social Services, resurfacing, gymnasium, resurfacing, but contractors requested it be bid as new paving since they feel like everything over there had to be taken up around the gym and repaved. Health Department was a resurfacing, motor pool was new paving, Water Department was resurfacing, County Park was new paving, and a paving project at the Ward site for solid waste was grouped into there as new paving. The total of the 9 individual projects came to a total bid of $1.2 million, which was way more than we had originally budgeted. This was put out for bid twice because we only received 1 bid the first time. We waited the time we're supposed to wait, and then we rebid it again, and we still only received 1 bid from the same company, Barnhill Contract. Our recommendation will be to let's take away the new paving at this point and focus on resurfacing, because we have some failing parking lots, such as Health Department, a section of paving at DSS. And it's very important that we keep these things intact and keep them resurfaced in a timely manner. We're already losing some of the Health Department parking lot. If we do that adjustment and take out all of the new paving at this point, we would have a resurfacing project totaling $371,086. And I've spoken with Ms. Lisa. We'll be working on any adjustments that need to be made to budgets and bring that back to you for a decision on to move forward with this. I did speak with Barnhill Contracting this morning, and they feel comfortable with going ahead with resurfacing at this point and taking the new paving out.
How much you say was budgeted? How much you had budgeted?
We had a total of $378,000 budgeted.
78,000.
Yes, sir.
Mr. Chairman.
Yes, sir.
So, Mr. McCleary, we had talked one time about paving the parking lot at the county park.
And that was included in this.
So it's out now.
It would be if we take out the new paving at this point. But it's a very expensive project.
Yes, Lawrence.
Mr. Chairman, just to kind of expound briefly on Mr. McCleary's comments. This is really for immediate purposes. We'd like to, as he indicated, the resurfacing is pressing. However, we would like to have the opportunity to regroup on funding for the new work and come back to you in the near future on that as well.
2 questions. One, just for curiosity, what was the difference in you said same company gave 2 bids back to back. Were they the same bid?
We don't know that because we didn't open the first bid. That was put in vault and held until they resubmitted. Well, they actually indicated that they had lowered the price, and we didn't ever review that first bid because it can't be opened if you only receive 1 bid for the first round.
The other question is, with pulling this out, 6 months from now, if we say, okay, let's go on with the new paving, it's not gonna come in at like 1.1 and we're going, my goodness, it just cost us $300,000 more.
Right now, the petroleum market drives paving. It's a petroleum product. We can't guarantee anything. That's one of the things we're seeing in the elevation of cost. When we prepare budgets, we use figures that we had 2 years ago and put an increase on that, anticipating some increase. Those numbers were for the paving we did for resurfacing of the library and the paving we did out of the EMS training facility. And we were nowhere close. And it's,
I guess that's kind of what I'm concerned about. Another 6 or 8 months, are we going to
Well,
go?
that's why we hope it won't be that long.
Okay.
For example, Kip, to clarify if this is not right, the estimate we had for the park was $295 or $260.
$295.
And it came in at what,
at $463.
And that was just a recent quote. You all know that was a recent, relatively recent quote. So it came in high.
Well, if you've heard recently, I've heard that building materials have gone up like 800% this year in the last year. So paving is following that trend.
For those that have ever built a house right now, $300 a square foot to build a house.
And used to be $100 was an expensive house.
Chairman, good. Now, the trash dumpsters that are located throughout the county, are they being paved or anything?
We have paved several in years prior. This year was a focus on getting the one done at Ward site. That's why it was put in there. Due to grade adjustments and things going to have to happen to make that water move off that site. That price came in at $160,000, way more than we spent on any of the other sites.
All right. Thank you, sir.
Sir.
Have we ever considered like a nice gravel situation? I mean, you know, like not marl.
That hasn't been explored yet, no, sir.
No, I was just wondering.
Marl's going to require maintenance.
No, I wouldn't do marl. That's not what I'm saying. I'm saying like a nice aggregate that, you know, marl is just a filthy mess. I would never do that, in my opinion.
But even a stone aggregate like we've used at a lot of our paving, solid waste dumpster sites, it requires periodic maintenance, adding more stone grading and keeping it level and smooth for traffic. It's better if we can pave. That's a more permanent situation, but paving, the natural life of paving is about 20 years and you're going to have to resurface it.
You're talking about, you're not talking about concrete when you talk about your paving?
No, sir, asphalt.
Thank you.
Thank you.
Health Department, Dr. Terry Duncan.
I'd like to introduce to you tonight Jordan Hunsinger. You met her in her first couple of months employment last year, and she gave an update, and tonight she's here to give us the annual communicable disease report.
Good afternoon. I'm going to skip over the first couple of slides as it reflects some COVID data from early December when I put this presentation together. I'm sure Ms. Terry will cover some more recent data with that. On the following slides, you will see the 2020 finalized data numbers for the communicable diseases in Bladen County. There were a total of 3 Campylobacter cases, 31 chronic hepatitis C cases, 2 leishmaniasis cases, 10 salmonella, and 1 tuberculosis. For the 2021 preliminary data, there was 1 Campylobacter, 1 acute hepatitis B case, 3 chronic hepatitis B cases, 46 chronic hepatitis C, 5 salmonella, and 1 tuberculosis case. On the following slide, you'll see a comparison of the increase in hepatitis cases from 2020 to 2021. On the next slide, you will see flu data. For 2020, there was 1 flu adult death, and 2021, there were none. On the following slide, you will see the rabies numbers. For 2020, there was a total of 1 raccoon that had rabies, and for 2021, there were 2 raccoons with rabies. On the next slide, you'll see sexually transmitted disease data. For 2020, the finalized numbers reflected 174 chlamydia cases, 113 gonorrhea, 2 HIV, 3 syphilis. For 2021, the preliminary data shows that we had 189 chlamydia cases, 113 gonorrhea, 3 HIV, and 3 syphilis. The next slide shows a comparison for the different counties and their sexually transmitted disease data. As you can see, Bladen County had 189, while Columbus had 306, Robinson 1259, and Cumberland 4214 of chlamydia. Bladen had 113 gonorrhea, Columbus 124, Robinson 702, Cumberland 1736. HIV, Bladen had 3, Columbus had 6, Robinson had 26, and Cumberland had 69. And for syphilis, Bladen had 3, Columbus had 5, Robinson had 9, and Cumberland had 30.
If we ask questions now, wait to end of this presentation.
Sir?
If you ask some questions now, at the end of the presentation.
Yes, sir, you can ask it now.
On the hepatitis, why is that seem to be a surge? Is it not, people not taking the shots, and why is it on?
There's an increase in hepatitis cases due to an increase in drug use in the county. Also included in your packet is a letter of recommendation to begin a needle exchange program. This is just the start of the recommendation from our HRSA regional consultant. Just something that we're trying to get started in the county.
Well, the only reason I was asking, I know at one time you had to take the shots for hepatitis.
You get hepatitis B vaccines when you're born.
Is that something that we still do?
Yes.
It's still elevating the cost of birth.
Yes.
So the next item on our agenda is update regarding the Health Resources and Service Administration, the HRSA grant, and its potential activities. The group is broken into some major categories. The school is one, and in the school setting, we are looking at having some life skills programs that would be carried on in elementary school and then in the junior high or middle high. And it would give educational sessions on making life choices and the good choices. It would be for both parents and children. There would be opportunities for the training is through this HRSA grant. So we're excited about that, and the school is excited about it. We're beginning to review the program's requirements now and get ready for our training there. Additionally, we have a primary care with Bladen Medical here. We're looking there at some of the same things that we're looking at with the health department and DSS group, and that's to sort of up our ante with the screening and referral process. We know that with this grant, we will have an addiction specialist at both the primary clinic here in BMA, as well as at the health department. So when we identify that there's a positive screening on an individual, we literally could walk the person to an addiction specialist. And you've already heard at least some of the problems that we have with substance abuse here in the county leading to hepatitis. Additionally, you heard about the potential needle syringe exchange. This, again, we've got some education and some work to do on that and learning more about it. We also have opportunities for some increased medication drops, thinking that maybe with Trillium and their behavioral health, it might be an opportunity that we could add a medication drop there. So lots of work is going on behind the scenes. We are up to date and are meeting the requirements of the grant at this point, even with COVID surging in the last 2 weeks. The next item is asking for your approval of the memorandum of understanding with for Trillium Health Resources and referral for that program.
Second. Last bit, seconded by Mr. Hester. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Mogollin? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
The next item is consider approving the Health and Human Services Advisory Committee operating procedures, and there were no changes.
Motion approved.
Motion by Mr. Bullock, second by Mr. Gillespie. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Mogollin? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
The next item is to update the strategic plan, and you had included in your packet the latest revisions to the strategic plan. You'll remember the first item was to improve marketing of the public health and services provided. I hope you have seen some of the billboards around the county. We began to now sort of let the community know where we are and what we're doing. We also have reached in excess of 10,000 or more feeds into our Facebook page. Some of it is due to COVID, some not so much. We knew that we wanted to highlight different programs each month. An example for that is the upcoming American Heart Month. Remember, I asked you last year on the first Friday of the month, please wear red in honor and awareness of women's health, particularly cardiac health. And the entire month is American Heart Month. Additionally, we are continuing to offer media campaigns. Certainly with the COVID, it has been a large part of what we've done for the last year and a half, but other work has gone on, as you can see from the strategic plan. The second was to expand employee training and health opportunities. We did participate in the Healthy Holiday Challenge, and we'll be able to give you some final numbers on that when the national organization provides that. Last year it was a little bit late, but we're hoping maybe as early as March. We are planning to work on employee wellness and exactly what does employee wellness look like. And the CDC has some recommendations for that. We're going to work through the safety committee. We have worked to get the NeoGov for education and training here, and we successfully completed that the last year. Sort of the health department was a guinea pig, and it worked really well for us. Thank you for getting NeoGov for us. We also have encouraged staff to attend training events. We had our interpreters to attend a certification training in hopes that they will be able to certify in the future, not right now, but in the future. And that was one of the first times they could remember going in years. We have completed SPICE training, not just for one nurse, but several. In the past, only the CD nurse was certified in SPICE, and now we have several members so that we can make sure that infection control is happening in our unit. Tiffany Pate and I attended the North Carolina Leadership Institute. So we have, Jordan is in the enhanced role nurse here for the STD clinic, and we also have an enhanced role nurse, Christy Thornton, for child health. If you remember in 2019, we had one enhanced role nurse, and at the end of this year, we'll have 4. The third one is to diversify and improve clinical services. We were able to start with sports physicals, and that's part of our child health program. We are now offering TB skin tests to students. We would like to offer employee health and some drug screening there, and working on a proposal that I hope that you'll be able to see in the new budget. And we did ask, with some of the ARPA monies, that you consider an employee wellness program and maybe an adult limited. That would certainly help here in this county. We continue to work on our breastfeeding friendly clinic. It's not in here, but we now have hired a breastfeeding peer support counselor, and those are pretty hard to come by when you look at the state regulations. So we feel like that we are on point. Even though we were busy, as you know, with COVID, we have not let any service at the health department lack.
Appreciate everything y'all do over there too, and that's not taken.
So the next item is the update regarding the community health assessment priorities. If you'll remember, we did a survey of the that's required every 3 years for hospital and every 4 years for the health department, but because we work with the hospital, we do it every 3. So the community has responded and listed their health priorities. In addition, that has been encapsulated. We are working now to identify those priorities, and as the Board of Health will be asking for your input, it might be as simple as participating in a survey. So please look for that to come. Currently, the priorities are substance misuse, second, maternal and infant care, and diet, exercise, and nutrition. And based on some of the early reports, it looks like some of those might be for future. And then lastly, I have the COVID-19 vaccination update. Today, we have 897 active cases that we know of. 1 month ago, we had 67. You can remember at the height of our July, August, and September, we had around 400 active cases. We have doubled. Thank goodness that Omicron is not as deadly as the Delta variant. Remember, we had 42 deaths in July, August, and September. It is very much more transmissible, to the point that today there were 4,630 hospitalizations in North Carolina. On Friday, there were 253 open ICU beds in the state. Today, there's 300 and some. So David Howell, I think, is still here, and I just want to, if you'll let him interject on how that has impacted EMS.
This variant is playing havoc across the state with all EMS systems. For us here in Bladen right now, I've got 5 full-time staff members on one shift that's positive, plus a part-timer positive. So you take 5 individuals on one shift, that cripples that shift for day shift. And like Ms. Terry was speaking, due to the bed capacities with ICUs, it's creating the issue where the EDs are having to hold these patients. So when the EDs are holding these patients, EMS is getting there, we're having longer turnaround times. Prime example, the weekend, I have one truck that was a day shift, that's at 5 o'clock that afternoon. Their shift normally ends at 6. They got a call a little bit after 5. Went to the call, transported New Hanover. These guys cleared New Hanover at 1 a.m. and got back to EMS base at 3 a.m. after cleaning and deconning the truck. We've had extended times here at the hospital locally, 2 hours waiting. Right now, I just got a message. Sampson County is on total out-of-county diversion. Southeastern's on total out-of-county diversion, which means we can't go to them from here. Cape Fear is on diversion on a thing they're accepting ischemic, trauma, and stroke. Bladen's on out-of-county diversion and total site diversion. These are things we're dealing with every day here lately. The state did put out guidance to us, which I don't know really how well it's going to help us here. Some practices in some of the bigger systems has been alternate transportation methods. This came out, I think, in health director's call, where they're actually being triaged by a paramedic on scene. And if it's not an emergency situation for an ED, these thugs are being taken by a taxi, an Uber, or a Lyft.
In Mecklenburg County.
In Mecklenburg County.
The county pays for the Uber driver?
I don't know the process. I'm not sure. That was just some things that was put out in the memorandum.
It's a $16 transport versus about $1,000 transport. So
right.
Even if the county had to pay it, it was much cheaper.
EMD, as far as using the EMD center to try to triage non-emergency calls, alpha level calls, try to encourage those people to go to urgent care versus calling an ambulance to go to the emergency room. Implementing 131 e-waiver, letting non-credentialed personnel drive one paramedic or one credentialed person on the ambulance, which we are working that. We did implement that waiver, but still it's a process to trying to get firefighters to do that. But just to give you guys an overview, it is across the whole state. EMS systems right now are taxed very, very thinly because of the bed capacities and things like that. So I was asked just to bring that information to you guys so you're aware of it. There may be extended response times. Currently, New Hanover has a 4-hour response time for an ambulance once the call is dispatched. So luckily here, we've been able to maintain within that 30 to 40 minute range Typically, we try for 15 to 20, but there has been instances because of turnaround times that's been 40 minutes. So you guys are aware.
Is your Bladenboro going back up and running?
They are providing coverage some nights. There's been some cases they haven't been able to. Any questions?
Is there anything that we could do to make this better?
More employees and more trucks?
At some point, there's going to have to be consideration.
I mean, when David shared all that during our department managers meeting this morning, and we're like, we definitely have to share this with the commissioners. Not that we know what to even ask for, but
right.
Or what to do. But
trucks right now, you don't have.
We don't have, it's not having the credentialed staff to run it. You know, I hate to say it like this, it may be, I need a driver.
Well, we've talked about the hospitalizations increasing, what impact it would have. It's here.
Right.
Now, in the past, I believe you had some concerns about filling positions. Do you have any open positions that have not been filled?
Currently, we have 4 vacant paramedics and 2 vacant EMT basics. And it's not, and let me make this clear, it's not only Bladen, it's systems around us. I lost a paramedic. In fact, tonight is her last night full time. She's leaving, go to nursing school. She got accepted in nursing school. I've lost several to nursing school. I've lost several paramedics to the hospital setting.
Are you finding that Bladen is basically a training program? Others transfer to bigger things?
I think these younger folks are actually looking at it for more, what would you say, clinical education and incentives and things like that.
Financial.
Well,
basically.
Okay.
I think
they want a better life.
Yeah.
And I think.
Yeah, and we can't fault them for that. You know,
That's right. What you're running into right now, some of your doctors are better off to be a nurse, a traveling nurse,
right,
making $400,000 to $600,000 a year.
Right. Right. And it's the
that's
same
what
thing.
you're up against.
That's the same thing for a paramedic. The paramedics go for practice. You know, an average paramedic is somewhere $19, $20 an hour. You can go to nursing school theoretically and what, $24, $25 an hour. Sometimes shift differential puts them up to $30. And it's basically kind of equal what they do in a sense in some things. So
Just having to run.
it's a tough time. But we just wanted to give you an update on as far as the COVID effect from the hospital side and the health side, how it's trickling into other areas of the healthcare side, especially.
With the testing process, I know I was over one day and I know they were stopping the line at 4:30. There was about 25 cars backed up. Is there a need for any additional testing sites here or somebody to make testing available in this county? You know, people coming over say they can't even get tested. Do we need to create something a little different? Or is there anything we can do to help with that type of situation?
We actually think we're in pretty good shape compared to some other counties on the testing process. And I think if we stayed open till 8, you still have a line out there.
Because if I just know some of them saying that they're going over and they come in, the line be so long, they leave, they'll come back. And see, those people are not getting tested. And my thing is they transmitting it because they can't get tested. Do we need to do something to try over more testing?
We try to encourage people to register. If you register to be tested, then they have a priority line. And you're also guaranteed a rapid in that line too, if they have rapids available. And there are several places you can be tested, not only at the health department, but at CVS, Walgreens, Anderson's. There's a Liberty Medical in Bladenboro testing. So I think we're in pretty good shape compared to other counties. They did 566 tests one day.
I'm thinking everything's fine on that. No need for additional testing.
Well, I mean, if we had 4 more, but.
Are you finding it difficult to defer transport? You know, like a person called for EMS to come, and they find out that they have a minor condition, and do you find it difficult to to not transport the citizens? Like, I think you said something about, if they have, COVID-19, that you can, they sign some kind of agreement or something where you don't have to transport them?
It's an option that the state has looked at. Some of the bigger systems like Mecklenburg and places like that do have that option to where they're sending a paramedic in a QRV to do an assessment. And if they feel that it's something that really doesn't need to be handled in the emergency room setting, they're transported by alternate means, you know, whether it be Uber or Lyft, taxi, or whatever the case, to an urgent care or places like that, alternate destinations.
There are people that think if they go by rescue that they're sane quicker. And they will call rescue just to get a COVID-19 test at the hospital. And that's not an appropriate use of the system.
Right.
And the county's protected doing that? In other words, the patient signs off on that? Is that what Ms. Arthur's after?
Yeah, basically they're refusing. Once they're assessed by us, then they sign a
I think his question was,
which we do not have anything like that in place. We don't. We're still trying to maintain our services like we've been doing, but we do have extended response times and extended turnaround times because of the capacity of the hospital.
his question was in the form of COVID.
Yeah.
And I don't know how you would know that in your defense. Or
We wouldn't. You know, we think that we're gonna transport.
Oh,
Now, it may be to here to Bladen County Hospital, but they're gonna get transported.
What I heard you say though, if I heard everything correctly, that, you cannot transport anyone right now outside Bladen County.
Right. If the hospital's on diversion, they will not take us.
Yeah.
I can't go to Southeastern if they're on diversion. You see what I'm saying? Because they're not accepting out of county ambulances. They're full. House is full, just like Cape Fear Valley.
There are people that have had to wait 6 and 7 days for a transfer.
Right. We've had patients here in the emergency room here locally that's had to wait several days for transfers out to other facilities.
Okay, one other question I have. Is the discretion for a school to close, that's up completely to the school or to the health department? Who has the discretion to qualify them to go up, to close the school?
There are some guidelines through DPI on whether whom can and when they do close the schools.
Are you involved with that process?
I'm involved with the discussions on how many cases they have. The decision is actually up to them. At this point, yes, sir.
I thank you, Mr. EMS. Thank you for what you do. I know it's tough now because of your staffing shortages, and matter of fact, your trucks, when they're on a call, almost an equipment shortage.
Yeah, it's kind of like the started territory for health and EMS right now. It really is.
Appreciate it.
It's been final. I want to say this is the first day in a few weeks that our positivity rate at 34.7 is higher than the state rate at 33.3. And we're at 20,000 deaths in North Carolina that are COVID related.
Second, one last question. Could you give any reason why you think the rate is increasing so high here? What's your feel?
Well, the rates are increasing because Omicron is so transmissible. I mean, it is such more transmissible than the Delta variant. You know, we continue to know that vaccination and wearing masks and doing some social distancing and hand washing are the keys to decreasing transmission of any kind of virus, and those things are known to work.
So this, but like, at one time there were restrictions put in place, like restaurants and schools. You saying that's not causing any of this problem? Would that be a problem with what's going on now?
Well, like the schools are still following the North Carolina School Toolkit recommendations, and it was just updated recently.
Well, the reason I was asking, because I live right now, everywhere I go into Walmart, there's no mask required. You go in the grocery store, there's no mask required. There's no requirement for anything when you walk in. Just sort of trying to present it, they say, well, you wear a mask at your pleasure. And I'd be scared to death to walk into places because nobody had masks on. So, I don't know, maybe that's just a force of another.
Well, the mask is not doing a whole lot of good. The percentage is very, very small with these cloth masks and stuff. Especially if you've got N95, you might as well not even have a mask. So, I mean, you know, what difference, right?
Okay, thank you, Doctor. Advisory Board appointment, Adult Care Home Community Advisory Board 2.
Motion approved. Second.
A motion by Mr. Lester to reappoint, second by Mr. Bullock. Further discussion, roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Airport Appeals Board 3.
Motion reappoint.
Motion by Mr. Gillespie to reappoint, seconded by Mr. Hester. Any discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson? Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Parks Advisory Board 5.
We got a communication that Mr. Joan Allen has requested to be replaced.
Mhm.
Motion tabled.
Second.
A motion tabled by Mr. Peterson, second by Mr. Gillespie. Discussion. Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
And D, East Arcadia shouldn't be on there, isn't that right, Mr. Martin?
I have to table
Next
it.
one.
Motion to
Yeah.
table.
Hold off back. It'll go away or dissolve as the fire department does. And I was speaking with Mr. Dallas. Those funds are to be distributed to the new fire. That will be the legal one.
So you
So why
recommend-
don't we just reappoint it and let it dissolve on its own? Motion to reappoint.
Got a motion, by Mr. Rick, got a second by Mr. Gillespie. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Lisbon Fire District Committee 3.
We got communications and that looks like
Replace
John
John
Clark.
Wayne Packer with Jamie Priest and replace John Clark with Kathleen Monroe.
John Carter. Second.
Got a motion by Mr. Peterson, second by Mr. Gillespie. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock? Mr. Gillespie?
Southeastern Economic Development Commission 1.
Motion reappoint.
Second. Motion by Mr. Gillespie to reappoint, second by Mr. Cameron McGill. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Trillium Southern Regional Advisory Board.
Motion to appoint Dr. Danny Ellis and Dr. Molly Glenn.
Second.
I make
Motion by Mr.
motion that.
Got a motion by
Was this
Mr. Peterson.
Was this for who?
We got a motion by Mr. Peterson for Dr. Danny Ellison and Dr. Molly Glenn.
And this
Got a
was
motion.
for Trillium?
For Trillium.
I have to make a motion that we put, Cogdale on that because he has experience.
Second it.
We got a motion and a second by we got a second by, a motion by Dr. Montgomery. We got a second by Mr. Bullock. So we'll go with, first motion first. Roll call for,
Can I modify
Danny.
that? I'm sorry. Was
Beg
that the
pardon?
other one? I want to know, because I support Dr. Ellis. I mean, there's two commissioners, so Mr. Cogdell and Dr. Ellis.
With your motion,
Okay.
Mr. Peterson, motion on the table first.
You
So
get a
we
second.
have- yeah, we got a second by Mr. Cameron McGill.
Now, who's what you say there?
Mr. Ellis and Dr. Molly Glenn sitting out here in the audience. She's also on the board for. Yeah. Right, any further discussion?
Yes, I
Roll.
still think that if that we have somebody on this board that I'm not knocking Dr. Ellis. He's professional. He can do it too. But I'm saying he and Mr. Cogdell. But at least Mr. Cogdell has the experience with mental health. He has a degree in exceptional children. He has a wealth of experience that we need to put him back on that, put him on that board. With Dr. Ellis.
We heard your discussion. Now we'll go to the roll call on Dr. Ellis and Dr. Mungoin.
No.
I meant Molly. Yes, Mom. Roll call, Madam Clerk.
Mr. Britt,
Yes.
Mr. Hester,
Yes.
Mr. Peterson,
Yes.
Mr. Cogdell, Dr. Ellis,
Yes.
Mr. McGill.
Yes.
Dr. Mungoin,
No.
Mr. Bullock,
No.
Mr. Gillespie.
No.
County Manager, Mark.
Thank you, Mr. Chairman. I'd like to begin, excuse me, by reviewing the calendar with you for the remainder of January, February. And just remind you that next Wednesday, the 26th, from 11 until 3, we have a strategic planning session with the Board of Trustees. Moving over to February, Thursday the 3rd at 12 noon, the JCPC meeting will take place, and that'll be a virtual meeting. On Monday the 7th at 8 a.m., there's a prayer service here. The board meets that evening at 6:30. Beginning on Saturday the 12th, Wednesday the following week, the NACO Legislative Conference will take place in Washington. The board meets on the 21st at 6:30, and on Friday the 25th at 7 p.m. there's a casino night as part of the industry appreciation efforts, and that'll take place at the Cape Fear Winery here.
Is that confirmed now, Mr. Mark?
I think that's the revised date. Yes, sir.
Okay, revised it.
The next item, moving to item B, we have a draft budget calendar for you for your consideration. And this really is a big highlight that includes a public hearing, as we've done in past years, just to invite public comment on general priorities, not really necessarily specific any more than they wish to share. But you have a copy of that pie chart that we'll share. We noticed this in the newspaper for the media. And then it sets the dates for the presentation and public hearing and adoption by the June. As we get closer to the process, we'll set more specific dates for budget work sessions.
Question to approve.
Got a motion by Mr. Peterson, need a second. Second by Mr. Cameron McGill, further discussion. Roll call.
Mr. Britt,
Yes.
Mr. Hester,
Yes.
Mr. Peterson,
Yes.
Mr. Cogdell,
That's all. Here's what you have, here's tentative on here, what you're asking for this, for something.
Yes, sir.
Yeah.
Dr. Ellis,
Yes.
Mr. McGill.
Yes.
Dr. Mungoin,
Yes.
Mr. Bullock,
Yes.
Mr. Gillespie.
Yes.
right, and moving to item C, just want to provide a brief update regarding the final rule that came out a week or so ago for the American Rescue Plan Act funds. And the main change in comparison to the, or contrast to the temporary rule, is that there is a standard allowance of up to $10 million that can be treated and basically as lost revenue under the temporary rule, which, as you all may recall, of the 5 categories, provided the most flexibility in regard to spending. So because Bladen only will receive approximately 6.3, all of the funds that it receives will be able to be appropriated for, I'll just use the general term, general governmental spending or whatever. So it provides, provides a great deal more flexibility for the county. And particularly, it'll make it so much more simple in terms of reporting and that type of thing. So
Not having to pay back for something or two.
well, it makes it a lot less likely that we'll, or more difficult to stump your toes, as opposed to the onerous details of the temporary rule. So we'd like to come back to you here in the very near future, and as we get into next month or two, begin having sessions again as far as get your priorities in terms of how you'd like to see this funds appropriate.
So we need to do that.
Mr. Martin, I would request that we don't wait a month or two, that we go ahead and get into it. We got our guidelines, asphalt's going up and everything else. We need to be moving. We don't need to be waiting a month or two. That's just my opinion.
Yeah, that's fine. I was just,
I think we need to have a special meeting to go ahead and spend this money.
I think that this morning, you just said they sent down new guidelines, governing how to be spent. Are those available for us to review, take a look at?
yes,
It's
sir.
on that.
So that, those are the set rules and guidelines.
Yeah, you can pull it up.
We develop, how we want to develop them.
Yes, sir.
So what I'm asking, just like if we want to use that ARP money for testing, we can do that.
Yeah.
If we want to use it for minority business, or small business, we can do that.
You can use it for, well, it depends, but you can use it, it also, remember, has to meet state requirements. So it's not just the federal rule. And I do need to clarify that. Remember, we had a dual requirement we had to meet it. The ARPA requirements, that's one thing, but it also has to meet all state requirements. So it has to be consistent with the.
Okay, so the reason I was asking, I know we had all this money at one time, we was talking about showing it into the, spending it back in the county needs. But we put it straight back into the county facilities, the county staff, county this kind of thing.
Well, we were able to do that with some of the funds on the previous.
Lovely, they carry that.
Right.
But his funds is be how different, am I right?
Well, now it makes it a little bit more, I mean, it wouldn't necessarily be to pay back the county or whatever, but it does provide a lot more flexibility. So you can spend it on any type of need, just like you're saying, the paving or, I'll give you a great example. Biker radio is the best example, clear example of a purpose that had been identified in the past that at the time was not eligible. Now it is back.
It'll hold the first allotment. It'll hold through the second allotment.
Yes, there are full, up to 10 million, so we're only receiving 6.3 of our entire allocation.
So it's strictly left up to the county commission to have the discretion on how that money be spent. So basically, we don't need citizen input at all. Is that what you're saying?
Well, we've already had that. We did provide that opportunity.
Okay, so that's what I'm saying. So once we had that citizen input, we finished with everything now, so we can start spending money the way we want to spend.
That's
enough. Is that what you're saying?
If that's what you're comfortable.
Are we gonna have another, session where citizens can make input again?
I mean, yeah, that's totally up to you all. We really went above and beyond in many respects doing that.
No, the only reason I'm asking the question, I've heard some, like maybe because they received more money than us. But they were saying that the way they correlated, they had guidelines that they developed internally. So that's not how they're gonna disperse them. They don't just come in and say this commissioner got discretion. They got.
And that would have been, that's exactly where we were with the previous, under the temporary rule. So for instance, if we were receiving 20 million, our first 10 would have flexibility. The second 10, we would have to comply with all of the details that we originally were aware of.
So now, since we lower than 10, we don't have to follow none of that.
Right.
we can just have a field day, how to spend, how we want to spend.
Well, you can spend it
You
the
got
way
to
that you determine
justify it.
the
You can't
best use of the funds.
Have you received, you only received half of the 6.3?
That's correct.
That's not a lot of money, so if you're talking about bike radios and stuff, that ain't a lot of money.
That's going to pay them.
And I was thinking that the money was designed for people who were impacted
That's not the way it was designed.
by the pandemic. But the way this seems like it's just, I don't know, maybe I'm looking at it wrong. It's not impacted consistent with dealing with people that was impacted by the virus. We just take and use it any way we want to use it. We want to buy a bunch of police cars. It doesn't deal with
Well,
impacted
they,
people.
all that's taken place is they've made it more they've increased the flexibility, so it still should be used however the board determines.
That's all I was asking, but we have to, could we specify somebody that goes bigger areas of the target where there's no restriction on, we just got no restriction at all.
No, we still have to meet the state, we still have to spend it in accordance with state law.
So those rules you have, those you and Lisa have, those we have to stand for.
It's right here, man. It's in that packet.
I understand that, Charles, I'm just telling you,
It's spelled out pretty clear.
It's over me, man, I'm just trying to
But I'm just trying to help y'all. I'm just trying to help y'all.
Well, you want to make sure the country knows what we're getting ready to do. They have the right to know what we're getting ready to do.
Individual delegation wishing to address.
Oh, can we, kind of see if we can get a date, Mr. Martin? I mean, it takes us, we don't just pick a date and meet, it takes weeks for us to get a date. Can we just sort of get a date and we have our first meeting?
Now,
That would be my suggestion.
Are you in a position to be able to?
well, the main thing is we just need to get a sense of, from you all as far as priorities and that type of thing. I mean,
Well, we need to set up a meeting to discuss that.
yeah, that's what I'm saying. I mean, that would be.
So, if y'all are prepared, we're ready to set the date. As far as your office and your staff, if y'all ready.
Is that 2 weeks? When are you all,
Tonight,
I know we have the 9th of March.
that's in February.
February. Oh, I'm sorry, still January.
That would give you a couple of weeks and get us, since we've got another meeting next Wednesday. Wednesday the 9th.
What's that look? Does that work? Let's start that work for her.
What's the time frame people with church on Wednesday, whatever?
Depends on what time.
I can't make it.
Okay, that was just a date. We were gonna be here all night until somebody threw out something. So Thursday the 10th, Tuesday the 8th. Tuesday the 29th of February.
Quarter what time?
5 o'clock.
Quarter to what, no,
6 o'clock?
6:30, yeah.
What day you looking at?
8.
So Tuesday.
I got a board meeting that night, so. It's
6:30?
6:30 be good.
6:30 on the 8th? 8th of February, Dr.
I can't make the 8th either.
I can't, I won't be out.
Oh, Mr. Carter, what day, start us a date, Mr. Martin.
18th either.
I can't make it.
Well, throw us a date out.
The 10th? How about the 10th for everybody?
If I can do something.
It depends what time. I have a meeting already that night. What happened to?
6:30.
Excuse me.
Good on that. I'm good anytime on that.
If it's 6:30, earlier. I can deal with 10 at 6:30.
6 o'clock?
Did he say at 6?
6? That good? 6?
I can't hear you, I'm sorry.
6 o'clock.
Okay. It's okay with me. I'm okay with that.
Everybody else good?
I'm good.
10th at 6.
Motion make it 10th at 6 o'clock.
Motion by Mr. Peters at 6 on the 10th, second by Mr. Cameron. That's the 10th of February at 6 o'clock. Any further discussion? Roll call?
Chris,
Yes?
Mr. Pepper,
Yeah.
Mr. Peterson.
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis.
Yes.
Mr. McGill,
Yes.
Dr. Mungoen,
Yes.
Mr. Bullock,
Yeah.
Mr. Gillespie,
Yes.
Is there a motion to adjourn?
Most of them.
Motion by Mr. Pierce, second by Mr.
Me,
Gillespie.
I just have one thing.
Yes, sir.
I just want to thank the commissioners that participated in the parade. Thank you very much.
Thank you. Roll call.
Mr. Britt,
Yes.
Mr. Hester,
Yes.
Mr. Peterson,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yeah.
Mr. McGill,
Yes.
Dr. Montgomery,
Yes.
Good night, Carol.
Bullock, Mr. Gillespie,
Yes.